series for National Public Radio about Olmstead and about this promise that people had of this new civil right to get care at home. So I went down to Atlanta. I wanted to meet Lois and tell the story that Sue told about how Lois had thrived in the community. I wanted to meet Sue, and so Sue said, "Come on down." And one of the first things she did was she wanted me to meet a client of hers named Rosa Hendricks, and she drove me. Sue drove me to this nursing home that's directly across the street from Martin Luther King's gravesite. And it was this, and if you go there, you turn around, there's this big red brick nursing home with a big plate glass window, and every day this woman, she was 87 years old at the time, Rosa Hendricks, would sit in the lobby. That was the place to so she could watch what was going on in the world. She could watch people go across the street to the gravesite. She told us that in all those years, she'd been in the nursing home for about 7 years. She always wanted to go. No one had ever bothered to take her across the street. But she sat there every day and watched everyone go by. She was a very independent woman. She needed very little assistance. She said that she was bored. She just sat in the lobby in her wheelchair all day. She said, "I get up in the morning, I eat my breakfast, I take a shower, I make my bed, and then I sit in this chair all day." She said, "I look out the window." She said, "At least it gives you something to do." So the only activity of daily living that she had any problem with was walking, but she used the wheelchair, she could push herself around, she did fine. So how did she get to the nursing home? Well, unfortunately, it's sort of a familiar story. She'd fallen, she'd hurt her leg. She was sent to a nursing home, a rehab nursing home for some therapy. She was told it's going to be for just a short time. Of course, it takes longer, and of course, there are questions about how good the therapy was that she was getting in the first place, or how much of it she was even getting. The Social Security check that she relied on to pay for her subsidized apartment, suddenly it's diverted to go to pay for her nursing home care. So she loses her apartment, and suddenly she has no home to go back to. Nor did she have family that would help her. So for her, the easy part was getting into the nursing home. The hard part was getting out for this woman who was very independent. And she told me, she said, "I'm stuck here." And she said, "I'd be all right if they let me get out of here. I don't need to be in any place like this. I need to be on my own." So she'd asked the state of Georgia, with Sue's help, she said, "Find me a subsidized apartment. I could use my Social Security check to pay for it. Then you can take the money that the state's paying for my care in the nursing home and use some of it to help me maybe get an aide to come in and help me several hours a day, to help me with my housekeeping, with cooking, to do some grocery shopping." And the state officials didn't really disagree in principle. It's just they said, "Oh, we have a waiting list," and they put her on the bottom. So, but fortunately, Rosa Hendricks had Sue Jameson working for her, and so Sue brings me and introduces me and said, "Look, this is just flat out segregation. This is a perfect example of segregation. This woman is here in this nursing home simply because she has some disabilities. It's a clear violation under the ADA." So Rosa's, and by the way, I should say that with Sue's help, she did get out about a year after that, and she moved into her own apartment, and she must be over 90 now, right? And she's still living independently with some help from an aide. But anyway, her story made me wonder, was there a way to measure how many people live in nursing homes today who could easily live outside of them? And it's not, so some people would argue that anyone can live outside a nursing home with the proper assistance. But Rosa's story made me wonder about how many people were in nursing homes who needed only a little assistance. So we went to the Department of Health and Human Services, and we did a Freedom of Information Act request for the data on the activities and daily living levels of everyone who was in a nursing home, in every nursing home in America. And we got some unpublished data. It was really interesting because we showed how, whether you were in a nursing home or whether you were living in the community, was often an accident of geography. So in Illinois, for example, we found that almost 21% of the people in nursing homes can walk by themselves. But it's fewer than 5% in Hawaii and South Carolina. Also in Illinois, about 12% of nursing home residents can bathe without assistance. In Iowa and South Dakota, just 1% can. In North Dakota, 60% of residents can feed themselves without assistance, but in Utah, only half as many, 30% can eat by themselves. Well, the differences were striking. And we couldn't, by looking at the data, explain the discrepancies, but other numbers we looked at sort of gave us some clues. Illinois was a place that has the highest percentage of younger people in nursing homes. Many are there because they have a mental illness, so they may be more physically able, and Illinois is among the states that spend a large percentage of their Medicaid long-term care dollars on nursing home care and very little on home and community-based care. And then we also found that two of the states that spend the most on home-based care, Washington and Oregon, they consistently scored low on the number of nursing home residents who could do things like eating and bathing without assistance. So again, that suggested that in states like that, independent people had access, that more independent people had access to alternatives. So we also looked at the CMS numbers of who's in nursing homes, and we found that there was one age group that was going into nursing homes in greater numbers at that time. It wasn't elderly people. It was actually younger, working age people, adults between ages of 31 to 64. And they were the only ones, when we did this story in 2010, they were the only ones that over the previous 10 years had been going into nursing homes in greater numbers. There's still a small percentage of people in nursing homes, but it was up, it was at 14% at that point, up from 10% a decade before. I spoke to a woman named Nancy Miller, who's a professor at the University of Maryland, Baltimore County, and she specializes in looking at this 31 to 64-year-old age group that's going into nursing homes. And she says they're more likely, compared to older people in nursing homes, to have some sort of chronic health problem. They've got diabetes or kidney failure. Many have mental health issues. But they need some simple help to stay at home, but they're in states that does not provide that. So the other thing I did in Atlanta, I also wanted to look at the issue of younger people, children and people in their early 20s who are in nursing homes. And the Georgia Advocacy Office, the public P&A there was running something called the Children's Freedom Initiative, which was trying to get children and young people out of nursing homes. And I went down there to see this also. The Children's Freedom Initiative had gone out and they found the parents of those children in nursing homes, and they said, we're going to show you alternatives, ways that your kids can live outside of the institution, group homes, adult foster care, how you can get aides to come into your house. And the parents gathered on a Friday night in a hotel outside of Atlanta, and I'm going to play just a little bit of the beginning of this story about these families.
In a hotel ballroom outside Atlanta, a young man glides his wheelchair to the front of the meeting room. With his twisted hand, he hits a button on a small gray box attached to the front of his wheelchair.
I am Matthew Harp and I am 22 years old.
Matthew Harp can't speak.
I have a muscle disorder that affects my whole body.
So he typed his speech into the machine that speaks for him.
And when I was 21 years old, I had to move into a nursing home because my mother and my sisters could not take care of me by themselves any longer.
More than 6,000 children and young adults up to the age of 21 live in American nursing homes.
I was the youngest person in the nursing home. Most of the others were very old. I had only a few friends that would come and see me. I missed everyone very much, and I wanted to leave.
After a year in that nursing home, Matthew Harp got his wish, and this past March, he moved back into his mother's home, thanks to a state and federal program that paid for aides to come to his house 9 hours every day. In the audience tonight, there are parents of other disabled children and young adults who are now living in nursing homes. And there's also a 23-year-old woman in a wheelchair who's come from the nursing home where she lives.
My name is Balan Alexander.
Balan Alexander is so shy she's barely spoken to anyone tonight. But after hearing Matthew Harp, she wants to tell her story to this room full of strangers. When Balan was just 6 years old, she had a stroke. Her mother cared for her at home, lifting her, bathing her, and getting her disabled daughter ready for school. Then Balan's mother got sick and was hospitalized. So Balan, at the age of 22, went into a nursing home. She expected it would be a short-term stay until her mother got better.
Just recently, my mom died.
The day of the funeral, aides at the nursing home got Balan dressed up, but the van that was supposed to take her never showed up. Balan missed her mother's funeral. Now Balan worries she's in the nursing home to stay.
I don't have anyone to take care of me. So I think I'm stuck where I'm at.
And then Balan went on to explain that she wanted to get out of the nursing home, she wanted to go back to high school, she wanted to get her GED, she wanted to find a job, and that was her dream of inclusion, to work. And she wanted, just like all of us, that identity that comes from having a job. But Balan never got out of the nursing home, and just several months after the story ran, she died in that nursing home. And she got a kind of pneumonia that's common when people live in nursing homes. She got an infection, and at the age of 24, she died. For me, there are two lessons in what I think of as Balan's unnecessary death. And first, we don't value the time of people with disabilities the way we value our own time. She was in that nursing home for 2 years while she waited for others to figure out how to set up the support she needed to live outside the nursing home. Too often, and I also thought about how too often we treat people with disabilities as commodities. Who gets the money that comes with their funding? There was a new federal program, she could have been helped by the Money Follows the Person program. It was the program that helped Matthew Harp get out of his nursing home. For Matthew, it paid for the aide who came into his house every day. It paid to widen the doors in his mother's house so he could get his wheelchair through. It paid to pave the sidewalk in front of the house so he could move his wheelchair to the family's wheelchair accessible van. And so Balan qualified for that money too, but there was resistance to getting her out. So first, a state psychologist had to come and certify that she was capable of living on her own. So Georgia paid to send a psychologist to the nursing home to meet her. But officials of the nursing home refused to let him in. They shut the door on him, even though he was a representative of the state. So Balan's advocates thought the nursing home simply didn't want her to leave, that they were afraid that they're going to lose the state funding that paid for her expensive care in this nursing home. So in the end, Balan's friends, they outwitted the nursing home. They arranged an outing. We're going to take her out to a restaurant, supposedly for lunch. And so they sent a van. The van came and picked her up at the nursing home, and of course then drove her straight to the psychologist. And he approved her for the funding that she needed to leave the nursing home, but still it took months to find an apartment, to find services, and then Balan, at this time of year, in January, she got pneumonia. And so I think Balan, she should be alive today. She never should have gone into a nursing home in the first place. When her mom got sick, it should have been simple for Georgia to send a caregiver into her home while her mom was in the hospital. It would have been a lot cheaper. And she should have finished high school in the first place. She should have had the support she wanted to go to college. She should have had the support she needed to work. And she should have had the ability to live the good, included life that all of us expect and expect as a given. So I often think about Balan and the people that Sue introduced me to there in Georgia.